Condensed milk and sweetened creams are deceptively rich, sweet products that pose a serious and often overlooked danger for individuals with diabetes. While they may appear as minor ingredients in coffee, desserts, or baking, their concentrated sugar content makes them potent triggers for rapid glucose spikes. Unlike natural dairy products that contain protein and fat to slow digestion, condensed milk and sweetened creams are loaded with added sugar, sometimes making up more than half of their total composition. This means that even small amounts can deliver a sudden and significant dose of glucose to the bloodstream, overwhelming the body's insulin response and destabilizing glycemic control. For diabetics, these sudden surges are not merely inconvenient. They can actively accelerate disease progression and increase the risk of severe complications. The metabolic effects of these sugar-dense products are immediate and harmful. In type 2 diabetes, repeated exposure to high sugar levels promotes worsening insulin resistance, as the body is forced to produce increasingly large amounts of insulin to manage glucose surges. Over time, this contributes to pancreatic beta cell exhaustion, reducing the body's ability to regulate blood sugar naturally and increasing dependence on medications or insulin therapy. In type 1 diabetes, the unpredictability of glucose spikes caused by condensed milk or sweetened creams complicates insulin dosing, increasing the risk of dangerous hyperglycemic episodes that can quickly escalate into severe complications if not managed properly. Beyond acute blood sugar effects, these products contribute significantly to long-term health risks. The repeated cycles of rapid glucose absorption and insulin response foster fat storage, particularly in visceral tissues around the abdomen, which further aggravates insulin resistance. This cycle is self-reinforcing. The more these sugar-laden creams are consumed, the more difficult it becomes for the body to maintain stable blood sugar levels. Additionally, the combination of sugar and saturated fats in many sweetened creams exacerbates cardiovascular risk, promoting atherosclerosis, inflammation, and elevated cholesterol levels. Diabetics are already predisposed to heart disease, and these products accelerate the likelihood of heart attack, stroke, and other vascular complications. The caloric density of condensed milk and sweetened creams compounds the danger. They are deceptively high in calories, offering no significant satiety, which often leads to overconsumption without awareness. Even a spoonful added to coffee or a dessert can substantially increase daily sugar intake, producing repeated glycemic spikes that quietly erode metabolic control over weeks and months. The body interprets these concentrated sugars as immediate energy, but stores the excess as fat, promoting weight gain that further worsens insulin resistance and complicates diabetes management. Psychologically, their intense sweetness and creamy texture trigger reward pathways in the brain, reinforcing cravings for sugary foods and making habitual consumption more likely. Diabetics may mistakenly perceive these products as minor indulgences, but each serving has an outsized metabolic impact. The combination of hidden sugars, fats, and dense caloric content makes them insidious contributors to poor glycemic control, reinforcing habits that undermine long-term health. In the long term, consistent consumption of condensed milk and sweetened creams accelerates the onset of serious diabetic complications, including kidney disease, neuropathy, retinopathy, and cardiovascular disorders. Even occasional indulgence can have cumulative effects, especially if these products are used daily in beverages, desserts, or cooking. For diabetics, these are not harmless treats. They are metabolic stressors that destabilize blood sugar, worsen insulin resistance, contribute to weight gain, and promote long-term organ damage. In conclusion, condensed milk and sweetened creams are highly concentrated sugar sources that carry immediate and long-term risks for individuals with diabetes. They rapidly elevate blood glucose, intensify insulin demand, exacerbate insulin resistance, and accelerate the development of serious complications. The perception of indulgence masks their true danger. They are not merely sweet additions, but potent metabolic disruptors. For those managing diabetes, avoidance of these products is essential to maintaining stable blood sugar, preventing cumulative harm, and protecting overall health. Each spoonful consumed is a direct challenge to the body's fragile metabolic balance, with consequences that can be both immediate and long-lasting.